Hopeful Beginnings is a 501c3 dedicated to perinatal mental health and adoption services. We believe in empowering women and families to build nurturing homes for children. The Hopeful Beginnings podcast tells the stories of pregnancy, birth, and parenthood through the eyes of professionals who serve families in our Chicagoland community. Find out more at hopefulbeginning.org. All right. Welcome back, everyone, to the Hopeful Beginnings podcast. Today, I am so lucky to have with me, who really needs no introduction, Lita from Ascension Health. Lita, I never do you justice when I introduce you. Can you tell us a little bit about your background and your credentials? I truly say you are like a superstar in the perinatal mental health world.
Thank you. I really appreciate that. So I'm a licensed clinical social worker, LCSW. I also have my PMHC, which is a perinatal mental health certification. I can give you a little bit more background on the PMHC and my history with that if you'd like. But I work at Ascension, Illinois, and I run our postpartum depression program. In 2015, I developed our perinatal intensive outpatient program. I also work at Partum Health as an outpatient therapist, and I also work on the North Shore Moms Line as a perinatal mental health clinician as well there. I'm a part of the Illinois Department of Public Health Maternal Mortality Review Committee, and I'm also involved with Postpartum Support International. I was on their board for 9 years, and now I'm still involved with them, working on conference submissions, working on PMHC questions for their future exams, and other endeavors. So,
yeah, I mean, I truly say, like, you have the scope of work you're doing in the perinatal mental health world and in general is really impressive. And for those who aren't familiar with the phrase perinatal, it's, maternal mental health, we often call it, but really that period of time, but but during pregnancy and those first couple years after birth. So I guess my first question is, what fuels your passion or what brought you to the perinatal world?
Yeah. Like many of us who work in this field, I had my own experience. I had my experience with postpartum anxiety. My first child, who's now 25, he ended up in needing to go back to the hospital because he spiked a fever within 24 hours after he was born. And with that, having to do a spinal tap on your newborn when you're all new, it just, it triggered a lot of anxiety. I had intrusive thoughts, had no idea what those were. And I always say, if I had known that there was support available, I would have done so much better. I did have a wonderful OB who got me treatment right away, and I did get help right away. So with the support of my family and everyone, I was able to come through it. But that really fueled my passion to say, there needs to be a lot more help around here. And at the time, I was also sort of in a transition phase, like figuring out what was going to be next with, parenthood. Mm-hmm. I had been a massage therapist for 10 years and was kind of thinking, what's next? So it really was a natural sort of fit into getting my master's in social work. And it became my focus from day one that I really wanted to work in the perinatal mental health space.
Yeah, I think you are so correct. Like so much of the workforce that we have, it is because us as women say, I wish I had, more support or different support, or I want it to be better, right, for other parents. That's really interesting that your background, I didn't realize that you had been in massage therapy first. There is a connection there, would you say? Can
absolutely.
You elaborate on that?
I felt like it was, a therapeutic connection that, there was some goodness that I was hopefully giving to the people that I was working with. So I felt like there was a therapeutic alliance, and I wanted to sort of build on that. So, for a moment I thought, is it nutrition? Where do I want to go with this? And social work just seemed to be really the natural fit. And yeah, I think some of the skills that, even just like anatomy and physiology, sometimes it translates into working with folks and saying like, oh, you have this pain? Like maybe you should, go and see this particular clinician. So it definitely translates. Yeah.
And I feel like especially as I look back on my history, I had a lot of perinatal anxiety, and I know you hold that in your body, right?
Absolutely.
And we see that a lot with clients. So I think we've started to talk about this a little bit, and we can speak from our own experiences, but also you have so many years of professional experience. What does postpartum depression and postpartum anxiety look like?
Yeah, that's a good question. I think that there is a notion out there that it's, moms who are sad.
Mhm.
And it is really so much more than that. Absolutely, sadness can be a part of it. So, tearfulness, feeling overwhelmed. But postpartum depression can also feel like irritability.
Yeah.
That's really one of the biggest symptoms that we hear about. And it's one that I spend a lot of time normalizing for the people that I work with, so that they don't feel like they're a bad mom, because that's another big symptom, is that feeling of despondency, of hopelessness, of I'm just never going to get this right. So, those types of feelings and expressions, hopefully people are expressing it. A lot of times, unfortunately, people are keeping it to themselves
Mhm.
and thinking, I'm just not good at this. And then with anxiety can come feelings of like, I'm never going to get this right again, feeling those intrusive thoughts. So intrusive thoughts are thoughts that are scary, that we really don't want to have, but that pop into our head anyway. So they often play out in sort of visual ways in our brains. And these are super common, both in moms and in dads. So we see that happening with anxiety that may also lead into OCD or
Yeah.
postpartum OCD. And our brains are really kind of wired to have these sort of OCD type of tendencies where we get very obsessive and very focused on our babies and the tasks that we need to do. And that can lead to just feeling overwhelmed with anxiety, not being able to sleep. That can be a really big one that we ask about too, is can you sleep when you have the opportunity to sleep?
Right.
So looking at sleep, looking at irritability, looking at nervousness, looking at all of those types of things. One of the guidelines that we give our patients that we speak with is anything 2 weeks postpartum and after.
Mhm.
If you're noticing that, you're just not feeling like yourself, just let us know and let's check it out and see what's happening. But of course, we also want to, acknowledge that it can happen and start in pregnancy as well. So that's why we talk about perinatal. So recognizing symptom changes in pregnancy is important too.
Do you see that's so much information you have given us. Like there's so many things we could talk about that. But do you see, I do feel like society in general right now, we're doing a better job
Mhm.
at mental health awareness. Do you see more clients coming in earlier because they are saying, oof, I heard perinatal mental health issues are common, or I heard about postpartum depression, I want to prevent it? Or do you still see a lot of stigma?
I think a lot of it is cultural. So I think that there's a certain culture where we do talk about it more. And I see, so one example that I give is, 15 years ago when I would walk into a postpartum room and I would say, I'm from the postpartum depression program. The dads would say, oh, I'm out. I'm going to go
Right.
grab a smoke. I'm going to go grab a coffee. But now they're really interested in learning and they're very receptive and they're asking about their own experiences with depression and anxiety. So there is a lot more engagement. But in certain cultures, in certain groups, that there's still a lot of stigma. Just the other day, I had a mom call and say, I've been really struggling. This is my third. I struggled with my first, with my second, but my mom kept saying, don't call. Don't call. They'll take away your baby. Don't
Yeah.
call. They're going to think you're crazy. So unfortunately, there still is a lot. There's an uphill battle, but the more that we talk about it, the more that our providers are open to doing the screening and, challenging any concerns that they might hear about, then we're going to keep doing better.
Yeah, I mean, that's the goal, right? That no one should be really feeling not like themselves, that we should all provide that space for parents to get through it, right, together with the community, with their support
Absolutely.
people.
It's such a big change.
It's a huge change hormonally. I mean, just the lack of sleep, especially I breastfed, so for my breastfeeding moms, I will always give them the props. Not that bottle feeding is much different, but to be awake every 2 to 3 hours for extended periods of time in your life, it does take a toll.
Absolutely.
Tell me a little bit more about fathers. So you mentioned that they're more interested in mental health, and I love to hear that. And I think it's so encouraging to hear that you have interest from the start, from when baby is delivered, that male parents are engaging.
Yeah. It's definitely something that we're seeing as a change over the last few years, that dads are really owning fatherhood and really wanting to be a part and recognizing that it's a benefit to them, that it's obviously beneficial to the family, but it's, it makes them feel good. It makes them feel like they're participating and they're engaged. So we definitely see the benefits, but we've also more understood about the fact that dads can also have postpartum depression and anxiety and OCD. So being able to recognize that and to understand that the biggest risk factor for a dad to experience a perinatal mood disorder is for mom to be going through that, right? And that's not to be blameful. That's not to say like, oh, mom, look what you did. It's really just to be able to recognize that when we see one, we really need to be looking at the other. So
that's interesting. Then I wonder where our screenings will go in the next 5-10 years. If there is a true correlation, we should be absolutely doing more intentional outreach.
yes, yeah. And I mean, we're talking about heterosexual partnerships,
Right.
but this is for all partners, for birthing and non-birthing partners when there are partnerships. So yes, absolutely.
Yeah. So we're talking about, male partners and female partners and family members in general. If say I'm grandma or I'm aunt and, my person has just had a child, what are some signs that I should look for? And how do we tell our loved one that maybe they'd benefit from support?
Yeah. It's amazing when people can have the support of family and loved ones around them. I think that's so important. And it's, again, something that as clinicians we need to watch for if there isn't that support available and to try to build that in with places like Hopeful Beginnings and in our programs as well. But when there are supports available for them to learn to recognize, certainly signs and symptoms, someone who maybe isn't eating, who is just not hungry, or someone who is awake and doing tasks at odd hours, someone who is reporting that they're feeling sad or feeling like I'm just not doing this right or feeling disconnected. So a lot of times moms will say, I just don't feel connected to the baby.
Yeah.
And, what I like to let them know is it's not that you're disconnected. Baby's connected to you.
Mm-hmm.
It's that depression has gotten in the way, right? This thing has gotten in the way. And once we treat that, and that's always the good news, is that treatment works, treatment is available, we can access it, that we can brush that away, and then you can start to feel that connection that actually is there, even if you don't feel it.
Yeah, that's my favorite line to funders. Like, I always tell them the thing I do love about postpartum depression is clients, they do get better so quickly when they have the supports, the correct supports in place. And it is really beautiful and miraculous to see that mom who is either doubting her ability or just, depression takes a toll on us physically, that they can't care for baby how they'd like to, get better and see that connection.
Yeah.
So tell us, you mentioned when you introduced yourself, Ascension has an inpatient IOP and a virtual IOP. What does treatment for postpartum depression or perinatal mood disorders look like in 2025? It is a bit different than before COVID.
Yeah, absolutely. 2026.
Well, 2026, you're right. Happy New Year.
So in our intensive outpatient program, as you mentioned, we have an in-person version and we have a virtual version. And when it was developed, it was only the 5th or 6th in the country, but now there's like 40. So this is really promising. And what an intensive outpatient program provides is a higher level of care than just seeing a therapist once a week or, going to an outpatient psychiatrist. So it's a little bit more structure, and really it provides a lot of that support that we were talking about, that, knowing that there's other people who get it, there's clinicians who understand it, and we can make sure that we can educate the people that they do have around them to be able to provide the support. So it might be that they're coming into our IOP, which meets 4 days a week. The in-person is 9 to 12:30. The virtual is 10 to 1. And they're learning, they're, having educational groups. So for example, when I teach in the program, I teach Gottman's Bringing Baby Home program. Okay. So John and Julie Gottman, couples researchers, a lot of people are familiar with them. And we talk about how relationships change and how to navigate that relationship in the postpartum. So they're learning skills. They're learning emotion regulation. They're learning expressive therapy. So they're learning ways to regulate emotion through maybe coloring mandalas or yoga or spirituality. So learning different skills to navigate their perinatal mood disorder and still be a parent. And the reason we have it specifically a perinatal IOP is so that they can bring their babies if they want to. And they
I've
can
seen
have that
your space. It's super baby friendly.
Yes.
There's all the swings and all the pack and plays and baby
Exactly.
mats, which is
Yes.
it's such a gift because I imagine, most moms or most parents that come benefit from having their kiddos there.
Absolutely. Yeah. And it can be a situation where mom maybe doesn't feel so confident. And so being in that space, they can increase their confidence. Or maybe it's conversely, they don't want to put baby down ever. So we gradually try to like build in some of that understanding that part of attachment is also separation, right? So that the baby can understand like, oh yes, she's always going to be there. Even if she puts me down for a bit, mom's always going to come back. So building all of those skills in. Being able to be seen by a psychiatrist who knows how to medicate during pregnancy and breastfeeding can be really important. And then again, understanding that the peer aspect of it is so powerful. So hearing a clinician say like, maybe you should try this tool or you should try this medication is one thing. But hearing from a peer like, hey, I tried this and it really helped. That can make all the difference in the world.
Right. It is truly like a blessing to have a community, and the fact that a program can create that for your clients is so encouraging that you've seen it work.
Absolutely.
You talked a little bit, you mentioned like Gottman's, his theories and his methods. Tell me a little bit about, because we get this question a lot at Hopeful Beginnings. What training do your staff or what training do perinatal professionals have that maybe a generalized therapist or clinician might not have?
If they have their PMHC, the Perinatal Mental Health Certification, then they've taken a 2-day training it can be through different agencies, but Postpartum Support International is the one that created the PMHC credential, and they can take the training through them. And then there's a 3rd day that's specific to the area of knowledge that they're focusing on as a clinician. So hopefully they have that PMHC, but they should also understand about infertility. They should understand about grief and loss when it comes to perinatal loss. And then the various perinatal mood disorders, as well as postpartum psychosis, which can be a crisis, an emergency. So it's important to understand all of those aspects.
I'm glad you touched on perinatal psychosis. Can you just explain that for our listeners? And is that something that you treat at an IOP, or how does that work?
Yeah, depending on the level of illness. So psychosis is when someone typically has lost touch with reality. They are having hallucinations and or delusions. Sometimes it's because there's an underlying bipolar disorder that is emerging maybe for the first time, or maybe it's come out before and it's just much stronger. A lot of times because of the sleep issues, right? The lack of sleep can really trigger these types of events for people. So if we can catch it early and we can start to medicate and start to tamp down some of the symptoms, it may be that the IOP level of care is appropriate. Often symptoms get bad pretty quickly, so we do need to hospitalize these patients. And then once they're stabilized a bit, once they've been on some medications and they've brought down some of those possible delusions or hallucinations, then they can participate in the IOP program to continue that learning and that support and that healing.
Yeah, I usually, when I'm out in the community talking about psychosis, I try, if you have a client that's reaching out to an agency like ours, or for you as a support person, it's lights, voices. What other hallucinations have you seen clients have?
So it can, I'll go with the delusions first, because delusions are when they're feeling like, people are listening. Like the CIA is listening, or the FBI is listening, or my neighbors are tapping my phone and thinking I'm a bad person. The delusions can include things like, my baby is not meant to be here. I need to save the world by hurting my baby. So those can be really scary, and sometimes moms recognize that they're scary, and so they hold on to them. So it can be really difficult to sort of tease out, unfortunately, what's really going on in their heads, but it's important to see. And often you will see a very big change just in their demeanor. Confusion is another symptom that I think is important to recognize. So, and it's not sort of that mommy brain kind of confusion that we see.
Which is very real. Like,
yes.
It sounds like a silly name, but mommy brain, I'm sure it's hormonal. There's something on the biochemical level.
Absolutely.
But it is a very real thing.
Yeah. This is a little bit odder. It makes you think like, well, that's really strange that she doesn't remember her child's name or, things like that. So yes, and then hallucinations can be tactile. We've seen moms who feel like, there's bugs crawling on them. Hallucinations can be auditory, where they're hearing voices. So a lot of times it is, hearing the voice of someone who has passed on, and that they're telling them to do certain things, or that especially giving them negative feedback about their parenting. And then visual hallucinations are typically also seeing people who aren't there, things like that.
Yeah, which is very different than intrusive thoughts too.
Absolutely.
Intrusive thoughts, I remember I used to do home visiting. It was one of the toughest concepts to explain to clients that hadn't have a therapeutic background, but intrusive thoughts are pretty common.
Yes.
Whereas psychosis is not.
Right.
You probably have it in your brain. What are the statistics for postpartum depression and its, manifestation in the population versus psychosis?
So postpartum depression is about 1 in 5.
Wow, it's 1 in 5 now.
Mm-hmm. Yeah.
It used to be 1 in 7. Is that correct?
Yeah. And, so much of it depends on how you study it and what you include. Are you including perinatal anxiety? Are you including, and what populations are you including? So, but it's safe to say I like to say it's about 1 million women each year in the United States alone.
Wow.
So I think that gives you a good, estimate about what you're talking about. With postpartum psychosis, it's about 1 to 2 in every 1,000. Mm. So, and we used to say it's rare, but we tend to not say that anymore because it really sort of stigmatizes the folks who do go through it, number one. And I think that it's a disservice to clinicians as well, because they think, oh, it's rare. That couldn't be what I'm seeing.
It won't happen to me. Yeah. Yeah, we had a case a couple of years ago with an individual reaching out, and it was psychosis, and it was very scary, but it was I will say, she got the treatment she needed. She got to the emergency room. It was a very good learning experience for our agency and our clinicians to realize, we will get these calls. Absolutely. And we need to be, prepared for them. Mm-hmm. What would you like the community at large to know about postpartum depression? A lot of times I'm speaking to people, they might be out of their baby years, right? Their kids have grown. But I think we all as a community should be educated. So what are the biggest points that you think are important?
It's treatable. It's something that deserves attention. Unfortunately, a lot of people still think, oh, it goes away on its own. They equate it with the baby blues still.
You'll get through it because I did.
Yeah.
Right?
Yeah. You'll be fine. You'll be fine. We muddled through. And that, it doesn't mean that you're a bad mom. Being able to provide compassion, I think, is just really important, to be able to give people grace, give people understanding, meet them where they're at. So if you're saying what can a support person say to someone who you think might need treatment is, it looks like you're not feeling so great. It looks like you're struggling. What can we do to help? Can I call someone for you? So different ways to just show that you're there for them, I think, is really important.
Yeah, it is so important. No door should be the wrong door, right? Mm-hmm. So if our listeners, or if anyone wants to get in touch with you, where can they find you, Lita? Where can they not find you, right? Because you can.
Yeah, that's.
But where's the best place to reach out?
So my phone number is 224-299-3220. That's the Ascension, Illinois phone number. And I'm on the website, lita.simanis@ascension.org. So those are ways to reach me. And yeah, those are the best ways to find me.
All right. Well, thank you so much for joining us today. I appreciate you sharing all of your knowledge, and it really is truly a pleasure to be in this field with you.
Same. Right. Thank you.
Thank you.